Pediatric Pain by Rachel Lumbert, registered nurse. Overview. Wesley Medical Center in Wichita, Kansas will be the facility where this research takes place, specifically in the emergency department, which has 42 rooms, and a ready care section that has 7 rooms for non-emergent conditions. The pediatric ER is open daily from 12 p.m. to 12 a.m. Wesley is a Level 1 Adult Trauma Center, Level 2 Pediatric Trauma Center, Stroke Certified, Chest Pain Certified, and has the specific Pediatric ER, which is open 12 hours a day. The research will include registered nurses working both day and night shifts, specifically in the emergency department. Patient population will be specified to those under the age of 18 years. The culture at Wesley Medical Center is of high standards. Their mission statement is, above all else, we are committed to the care and improvement of human life. Their vision is to bring exceptional health to every human being. Chaplains are always available on campus, but the hospital does not affiliate currently with any specific religion. Wesley Medical Center core values are integrity, compassion, accountability, respect, and excellence. Integrity is defined as doing the right thing, even when no one's watching. Compassion is defined as being empathetic to the needs of others and sympathize with their situation. Accountability is defined as taking ownership for how one's actions impact others. Respect is defined as valuing others and embracing diversity. And excellence is defined as taking personal pride in exceeding expectations. The issue is inadequate pain assessment and management in pediatric emergency patients. Pediatric patients often cannot verbalize their own pain or the severity of it, and thus are unintentionally subjected to unnecessary pain. This is an issue due to the fact that children who associate doctors and medical staff with pain will not likely be forthcoming with their feelings and receive proper treatment. The question is, what can be done to improve pediatric pain assessment in the emergency department? Social impact. Inadequate pediatric pain control leads to said patients associating pain with any and all medical visits. While there's pain at times, it doesn't need to be a constant fear for these patients whenever they're in a medical or healthcare setting. When patients understand that the nurse's goal is not to harm the patient but help them feel better, often their behavior improves to a place where they work as a team with the nurse to accomplish the task. Wesley Medical Center employs child life specialists that assist in providing safe and comfortable environments for the children all throughout the hospital, even if they're not the patient. 2 child life specialists work specifically in the emergency department for the hours of 12 p. to 12 a. There is always a child life specialist on hand in the ICU and floor, analyzing the issue's strengths. Nurses are required to spend several days on orientation in the pediatric ER and 1 day with the child life specialist. Nurses who work in the pediatric ER more often are commonly sought out for help by staff that's less familiar or comfortable with pediatric interventions. Child life specialists feel very comfortable speaking to medical and nursing staff about managing patients' pain more intensely when a problem is seen. The weaknesses are nurses don't recognize how important pain management is, even when a critical patient is in front of them. That patient may still be having pain that needs to be controlled while their other illnesses are being controlled. When nurses feel rushed, it doesn't encourage them to take the time to teach a patient about rating their pain and understanding available pain scales. And new nurses often don't feel comfortable asking for specific medications, be it anti-anxiety or analgesics from a physician. Recommendations are that nurses are educated on the signs of pain in pediatric populations. We recommend that reinforcement of nonverbal pain scales. Require all nurses to work in the pediatric ER, specifically if uncomfortable, so as to learn how to properly communicate and assess children. And providing education, teaching coping techniques, and explaining procedures and treatment flow during the visit should be done by trained emergency department staff and child life specialists when possible. Mandating pain assessments in every patient, because the implementation of a pain assessment protocol is one mechanism to standardize nursing practice with pediatric patients in the ED setting. Encourage the use of the FLAC pain scale when appropriate. With this, it does require the nurse to observe the patient for 2 to 5 minutes minimally, but typically a assessment in the emergency department takes at least that long. Administration of analgesics and anesthetics should be painless or as pain-free as possible at all times, which entails teaching nurses how to implement comfortable administration techniques. Oftentimes that involves keeping family members bedside or having the patient sit with family members so as to increase their comfort in the situation.